The Cannabis Conversation. A European perspective on the emerging legal cannabis industry.
Welcome to the Cannabis Conversation with Anuj Desai, where we explore the new legal cannabis industry by speaking to the professionals that are helping to shape it. On today's show, we've got a special on the new FSA announcement on novel foods for CBD. We've got the Association for the Cannabinoid Industry here to talk about what's just been said in the last couple of weeks. On the show, we have Dr. Parveen Bhatharah, who is the Regulatory and Compliance Lead for the ACI, and Dr. Sarah Gaunt, who is from Global Regulatory Services, working as a consultant with the ACI. Hi, guys.
Hi, Anuj.
Hey. So, loads to talk about. I think this has been a long overdue pronouncement from the FSA, so lots to dig into. Before we crack on, maybe it's good to sort of take a step back and briefly talk about what novel foods is, or the novel food regulations, rather.
Yes. So the novel food regulations is a European regulation which states that foods need to have a history of safe consumption. And if they don't have that history of safe consumption within Europe, they need to undergo a pre-market approvals safety assessment. So that entails proving that the product is safe, proving that you can manufacture it to consistent standards, proving that you've got the stability of the product, and putting all this information in a dossier to the European Food Standards Agency. They will do a risk assessment and say whether it's safe to be on the shelves. Now, in the case of CBD, that was put on the Novel Foods Register last year, which means that it is a novel food, which means it should have gone through a pre-market authorisation step and safety assessment. However, obviously, we all know that CBD products are on the shelves, so now we have to do it retrospectively and get a safety assessment for those products that are on the shelf.
Right. So, technically, those products hadn't gone through the necessary checks and balances, but the FSA wasn't enforcing against those products.
Exactly right.
Right. Okay. So, what exactly have the FSA said?
Well, on the 13th of February, FSA has made it clear on their statement that the companies who have their product on the market already, they need to do the retrospective application, novel food application by 31st of March 2021. Otherwise, their products will be taken off the market.
Okay, so that's for products that are already
on the shelves.
Okay. New products? So products that haven't been launched yet?
The products who haven't been launched yet, those products need to go through the proper novel food application and the authorization and the approval. Only then their products can be on the market.
Right. So they can't just launch a product, they've got to go through the process.
Yes.
Okay. And while we're talking about this, what is the sanction if someone decided to sell a product that hadn't gone through this process, a new product? Is it a matter for the Trading Standards Association?
It is the matter for Trading Standards Association,
right.
Yes.
And they would effectively have the power to take it down. They'd say, you don't have the necessary paperwork, so you can't be selling this product.
Yes. Exactly.
Great. So there's loads to unpick here, but who does this actually apply to? Because the reality of CBD products on the market is often they're just brands who are buying raw materials from wholesalers or white label producers. Who does this process fall down on?
This process is for anybody who is actually bringing their finished product onto the market, the CBD containing product. They need to ensure that their product has been gone through the necessary novel food application. That will include the main key raw material supplier, which may be the supplier of the raw material of CBD, and then they are using that material to make their finished products. So they need to ensure that they have the full process going through the novel food application. However, I understand that there will be cases where there will be multiple finished product producers who are using the same supplier's raw material. In those cases, again, they have to do their in-house technical due diligence to ensure either they have a collaboration with the the raw material supplier, how they're going to do the collaborative application. And if for technical reasons or for their IP protection reasons, they can't share their IP with the raw material supplier, then they need to have their own application with their proper stability and authorization for that manufacturing process, but citing the novel food application number used by their raw material supplier. So effectively it's their responsibility to prove that the raw material they are using is also manufactured in a safe way as required by the novel food regulations.
Okay, so it's quite complex there, isn't it? Effectively, if you are, the buck stops with you if you are the last step in that chain between you and the consumer.
Ultimately, the person who's putting the product on the shelves has the ultimate responsibility to ensure that that product is safe, and that is food law. That's not novel foods, that's food law. So it is ultimately the responsibility of the seller, the end seller. So,
for example, Boots or Holland & Barrett, would they, because they are effectively the seller, or is it the product?
The product should be safe when it goes onto the shelf. So
they should be asking. They should be asking. They shouldn't. It's their duty to ask those questions.
Yeah.
Right. So effectively, they're going to say, "We are the shop front, but in order for us to stock you and have you on our shelves, you need to give us all of this information."
And an end product manufacturer, someone who's making those gummies or those oils, needs to look down their supply chain and say to their ingredient suppliers, you need to be compliant to go into my product. And that's the way the responsibilities should be.
Right. Okay. So there's lots there as well. And so obviously, brands tend to have a number of product lines. It can be dozens, can be more than that. Do they need to go through this process for each? We'll talk about what the actual process is in a second, but would they have to go through this process for each individual product line?
That's a very good question. I have been asked that question again and again. And it is, again, forced on to the responsibility of the multiple product supplier. If the brand is having multiple products, then they need to do their own risk assessment to say what is the differentiation from one product to another. If they say that actually instead of using a coconut oil, I'm using a completely different oil, and there isn't significant difference, then all they have to do is that justify that and record that and have a discussion with FSA to say that, in my view, there's no difference. We've done the risk assessment and then there's no issue. But if the process is completely different, that going through completely different formulation, using the products or the excipient used in that finished product may be acidic, or they're going through the higher temperature where there is a possibility that product may be degrading, again, it falls down to the stability of your stability data. So if your stability data is saying that your product is stable, no change is happening, well and good. So you have evidence-based scientific data.
Yeah.
And if not, there are some issues, they will see in their stability already, and they will know automatically what needs to be done. This process is different because the stability is telling them, or stability data is showing them there are differences, and hence they need to justify that.
I think the key point here is those finished products, when they're put on the shelves, they've got a shelf life on the label by law.
Yeah.
Companies should have some evidence to show why they've put that shelf life on there in terms of stability data. So this is data that companies should have anyway, regardless of whether it's a novel food or not.
Yeah. I think this is a really important point because we're using accepted and widely used food law, if you like, which applies to any kind of consumable food products in the market, so the best before dates, etc. And we're simply applying it to this, whether people like it or not, this new type of product that's emerged onto the market.
Yes.
Yeah, but we still have to abide by those original food laws, regardless of whether it's a novel food or not.
And ultimately, it's the FSA who give the thumbs up or the thumbs down. So you say, a hypothetical is, I've got a 100 milligram tincture but I've got it in 3 different flavours. And I, as the manufacturer, will obviously want to limit how much money is spent on the application process. So I will say, well, my one set of data for this works for all 3 products. And then whether that's right or wrong, I don't know, but it's then for the FSA to say, well, we agree with that or we don't agree with it.
As long as you provided the data to show that those 3 products are equivalent, and you expect the shelf life to be equivalent because you've already got your shelf life data before you put it on the shelves, then at the minute it will be the European FSA doing that risk assessment, and they may come back to you with questions and say, can you prove that this is equivalent to this product?
Miss, I feel that before they even go for the FSA or FSA, they would know automatically if they are generating the stability data. I know for sure there are products, especially the cannabinoid products, in different flavors. They degrade much more quickly as compared to other flavors.
Right.
So that is where the key lies.
Okay.
They need to generate the stability data, compare that stability data, and if they think that, yes, I can generically say that I have got 2-year shelf life, well and good. But if the data, your stability data is showing that in one flavor you're having the degradation, so you can't apply the same shelf life to the other one. So automatically you have the answer what need to be done. Yeah. So people are, in my view, they need to do the in-house technical due diligence themselves.
Yeah.
So they have the answers.
Yeah. So it's isn't as simple as something as flavours, that can also affect the last mile, I suppose, to getting onto the shelf. Okay, so if we take a step back, then the announcement was there's a grace period until the 31st of March 2021 in order to have a valid application in to the FSA for your product. What does valid application mean?
So it's a validated application.
Application.
When you submit your dossier to the European Commission, there is a big checklist and guidance of how you generate all the data that goes into your dossier. The European Commission will look at that dossier and they will look at the data that you provided and the format that you've put it into the in and make sure that everything stacks up. It's good quality data. You've filled out all the gaps that you should have filled out, and then they'll validate it, or they won't, and they'll send it back to you and say you need more information here, or this doesn't follow the guidelines.
Right.
So it's that validated step. Once it's validated, and then it's passed on to FSA to do a risk assessment.
Okay, and how long does that validation process take?
We've been told 1 month.
Right. Okay. Is that ambitious?
No, they have confirmed it. We have double-checked it.
Yeah.
They're saying 1 month. Yes, the further down the line, which is the next step, is the risk assessment. That takes a little bit longer.
Yeah.
But having said that, again, we are not in the EU.
Yeah.
By the 31st, we won't be into the EU. It's only one state, only UK. So they have to make a decision. There is a pretty good chance it can be expedited. But we have to see in real time.
Sure. So whilst there's the date of the 31st of March, you actually have to give something to EFSA before then.
Yes.
Yeah.
So you'd submit it into the European Commission as it stands at the minute, and you've obviously got that 1 month. You also probably don't want to leave yourself with, if they say, oh, you're missing this data or you're missing that data, you probably want to leave a little bit of time so that you could go back if you haven't quite filled it in right.
But the general advice is do the both, give the same application to EFSA as well as the FSA as well.
Yes.
Yeah.
Until the transition period.
Mm-hmm.
So I think it'd be prudent to possibly, the end of this year, really, you want to get something in so that if anything comes back, you've got time to correct it and submit it. And then once it's in there, by the time, by the deadline, how long will it then take from that point to get authorisation?
From the European side of it, approximately 18 months.
Right.
So they do a risk assessment, and then European Commission receives the dossier, they validate it, then it goes to EFSA for a risk assessment, and they give their opinion, and then it goes back to the European Commission to write it into legislation. But in that process, they've got to get 27 member states to agree on EFSA's opinion, which is where quite often some of the time lags are. So potentially the UK version, which is pretty much very similar, could be faster because we don't have 27 member states to agree things.
But this is going to be for each individual product that this needs to happen?
Each individual application.
Yes.
Right. Yeah. Okay. Wow, that's quite long.
Yeah.
And then I guess at the end of that period, they could deny your application.
Yeah, I mean,
Yes.
In which case, you would no longer be able to sell it in.
Well, denial is not a right word. They will come back with a more RFIs, which is request for further information.
Okay.
So they will always come back.
Yeah. Okay. So you're still in the game. You
Yes.
just need to
yeah.
Absolutely.
to give them the comfort that they need.
And that 18 months is dependent on no requests for further information. So once you start getting requests
So
for
that's
further
perfect.
information, it starts lengthening out that process. So
Right.
yeah.
Because as Sarah mentioned, because we are no longer in EU, so it's only a UK team to just inspect that application and make a verdict. So it should be, in theory, much faster,
Right.
but we will see in real time.
Yeah.
But just to clarify on that, the FSA in the UK have said that they've kept the same same timelines that the European Commission have got.
Right.
So
But they're trying their best
they
to
will
see
try
if
their
they can
best.
fast track.
No promises, though. Okay, so and I guess we kind of covered it, but what is needed for a successful application is effectively the right amount of data to show that this is a product that, will not cause harm to consumers.
So the things you are looking at is you're looking at your processing, so your manufacturing, that you've got controls around your manufacturing. You're always producing a consistent product. You've then got the testing to show that you've got a consistent product, and you've got good validation methods for your testing. Then we move on to safety of that ingredient and proving that it's safe to use. It's safe to use repeatedly in a food product, not in a controlled environment that you might use a pharmaceutical. So as a food product, and also with consideration of vulnerable groups, because it's a food product, anyone can get hold of it. So you've got to do a risk assessment around those areas, and then and some studies to show that it's safe, and then some stability. So what products, this ingredient that we've got, we know it's safe now. What's it going to go into? Is it going into gummies? Is it going into chocolate? And when it goes into these products, what's the shelf life? Yeah. And what happens during the processing. So making sure that it doesn't degrade to any unsafe products, essentially.
So in essence, it's the responsibility of the company who is putting the novel food application that their process is safe and safe for the consumer. So they need to justify their data that it stacks up from the manufacturing point of view, from the stability point of view, from the shelf life point of view, and from the safety. So they need to make sure that every category is safe and sound and is safe for the consumer and not misleading to the consumer.
Yeah. What sort of studies are required in relation to this? So is it the broad study of CBD as a molecule or compound and how that affects the human body, and or is it company X's product, CBD product? Or is it a mix of both, I suppose?
That's really very, very complex. So it sounds like a simple question, but if I break it down in the scientific language, it's a very complex question.
Okay.
In the sense that
we need to dumb it down because I'm not very bright.
No, not at all. I mean, it's that first of all you break down to your raw material, CBD raw material supply.
Yeah.
So how that CBD is extracted, manufacturing process, because it can be extracted by solvent extraction,
CO2.
ethanol extraction, CO2, or it might be in future some various other different methods. So you can't really say that it's the same, because that manufacturing process might lead to some of the elements which might be impacting the safety. So it's again go back to the risk assessment. You need to risk assess your process and then do your safety studies based on that risk assessment. And then that's the first part. And then that's the key raw material part. And then we come to the finished dosage form. And if you are saying that actually I have done my whole process validation, shown that my process, I've got a safe ranges, I've got a sustainable manufacturing process, no variation in batch-to-batch manufacturing. I have got whole process stability data showing there is no degradation, and hence the excipient which I'm using in the finished product manufacturing are all known ingredients where the safety is already pre-justified. And then, yes, you don't have to do any more on the finished product as long as we've done the key raw material one. Because in this case, the key raw material is a CBD, and that's why they're considering CBD as novel, and they're asking for more safety data is required.
Yeah.
But that doesn't mean that you can say that your finished product made from that is automatically safe.
Yeah.
You will have to do your risk assessment to show to the regulators that all the ingredients going in there are either pre-existing data there on the safety and it's safe, and I've validated it by showing that my product doesn't degrade either from the stability data, and everything is based on the risk assessment. Show the risk assessment with the evidence-based data and it's safe.
Yeah.
So you say it's safe, show by the evidence of your scientific data it is safe, and then submit your application.
Yeah.
Because regulators are looking for the evidence. You are saying safe, show me data showing it's safe, then I'm happy.
Yeah. Okay. So I mean, it's effectively backing up your claims, and customer safety is sort of paramount.
Yes.
So it is what it says it is, and it will maintain that until the best before date, effectively. Okay, so this is a bit more of a wider industry question. It feels like, from what we discussed, that the majority of the burden falls on the brands, i.e. the person that is selling the product at the end of this. Clearly, this whole process is A, time-consuming, but B, also going to be not cheap. Is it as simple as that? Is it going to disproportionately affect the brands, or are the brands then going to expect their raw material providers to do half the work?
The key safety studies should really be carried out on the raw ingredients, so it's actually further down the supply chain. The key thing for brands is to ensure that supply chain is compliant, and ensure that you've done your due diligence and you're using suppliers who've got the safety data or are going through the novel foods process.
Okay. Right. So it's almost like if I'm going to buy raw materials from you, Mr. White Label person, I need all your badges so that I know what I'm getting. Yeah. And then whatever I do to it, whatever formulations, whatever extra ingredients I put in, I take responsibility for that.
Yes.
And that's the bit that I would provide. I take your data and also provide it as part of my application.
Yeah.
Absolutely.
Okay, cool. I'm glad I understood that.
Good. Very good.
So as we kind of alluded to, this is not it's not novel in that these are systems and practices that apply to all foodstuffs that are for sale, and it's simply because we don't know, or the regulators don't know enough about this, that they're applying it to this new type of product, although lots of people argue that it's old. What other types of food products have gone through the novel foods process?
There are, I think the main example, just recent one, is the chia seeds.
Chia seeds, okay.
And they've gone through the novel food because they were not in our novel food application, food chain. And these chia seeds also have a key issue attached to it, that if you are heating them, they degrade, and there are issues, and there need to be a further stability data. So that's why, if you're depending how you are using the chia seeds, whether you're using at room temperature or at higher temperature, again, your formulation, your manufacturing process of use makes a complete difference how you're gonna justify your application.
Right.
You need to generate that stability data. You need to generate that appropriate safety data for that. And there's another example which Sarah is going to go through.
Yeah, so insects until recently were seen by the UK as not novel foods. Insects and products derived from insects.
As in eating
insects, and more importantly, deriving sort of insect protein and things from insects as opposed to eating whole insects. So they were added to the Novel Foods Register, and the UK has recently turned around and said, yes, they aren't. We now class them as novel foods. And they're in a similar situation to CBD in that a lot of products were already on the market. So again, they were given a grace period to get applications in. So they are in a very similar process to the CBD area in that they're generating this data, but they've got products on the shelves as well.
Right, interesting. Have they finished that grace period yet, or are they in the middle of it still?
I think it finished at the end of last year.
Okay. With the chia seeds example, and presumably chia seeds weren't on the shelves before this novel foods proclamation, I'm going to call it that, was given to say that we deem this to be a novel food. So people effectively weren't allowed to sell it, or if they were selling it, they were selling it illegally, and they had to go through this process. Were there any kind of learnings from that you know of?
The learning, I was saying that people are just saying that it's not that they, like the CBD, if the key raw material supplier has done the safety data, I assume I use it to make any food type, different type product, easily, no problem. That's not the case.
Right.
That's what we learned was that depending on what formulation, what manufacturing process you're using, it will have a different stability. So we need to ensure that whether it's room temperature or higher temperature making the difference.
Right. Okay. So yes, the last mile, I guess, what you as the brand or the product
need to justify.
Owner, what you do to the product, what do you do to the raw material, that will affect the stability, and that's the bit that you need to prove.
Absolutely.
Right. Great. Cool. And I guess the last cool question is, what are the ACI doing sort of to help companies in this space?
Well, ACI is assisting members to doing the clarification, which we are doing again today as well, and also assisting them in the application via GRS. Sarah and Greer are helping them in putting the application together, and there are, as I say, that CBD products are considered as novel food, but they are not a normal novel food because we are dealing with the cannabinoids. Cannabinoids are temperature sensitive, air sensitive, light sensitive. So it's very important, depend how you're doing the formulation of these products, how you're presenting your finished product is absolutely key. And so we are assisting our members on that. And not only that we are going through this grace period at the moment after FSA's announcement on the 13th of Feb from now until 31st of March, you've been given a grace period. But what happens in between? Because people are coming to us that I want to take the CBD product. I don't have a confidence to take this CBD product because don't know the quality. I don't understand that they're safe for me or not. I don't have anywhere to just say that because they are not gone through the novel food application. How can I say that this has been manufactured through a right, appropriate legislation, regulations, and they followed all that until the approval happens.
Yeah.
So we are assisting them. We are launching our audit, and then we'll be putting in ACI kite mark. So companies will be going through the 3-step procedure where we'll be launching the initial bronze kite mark, where the companies will be audited to confirm that they are following all the appropriate regulations and their data and the facility and the team members are trained as per the regulations. And then once they have submitted the application, while their product is still on the market, because the commercial aspect is still going on. It's not coming off until the 31st. So this gives the consumer a confidence that they can verify that the product is safe with having seen that ACI kite mark.
Yeah.
And then once their application is gone through the second stage of the validation, then they will be issued a silver kite mark, and then once approved to the gold standard. So we're going through this 3-step process.
Right.
At the moment, we are planning to launch in early March, and we're nearly there.
Great. Cool. Exciting times.
It is.
I just actually Something came up while you were just explaining that point. Do you think CBD is a bit of a generalisation in relation to this? And what I mean by that is, obviously, people sell CBD isolate, but there are a lot of broad spectrum products which have not only CBD, but a lot of the minor cannabinoids as well. Presumably, this kind of regulation is designed to cover everything in relation to that.
Yes, there's lots of guidelines on simple molecules, but also guidelines on complex mixtures, which is what this product would be certainly described as, and extractions from plants. So there's a lot of guidelines to be able to tackle complex products like the ones we're talking about. And it's all about generating safety data on the product itself, not necessarily just the key ingredient on the whole product.
Yeah, which is what we talked about. And sorry, things are coming into my head crazily. How long does this novel foods categorisation last for? In 10 years' time, will people still need to go through it, or will it then be deemed to have been in circulation for long enough that...
No, the cut-off point is May 1997 for novel foods. So anything that's been used before, I think it's the 15th of May 1997, is not a novel food. So if you can prove use before then, that's fine. Up until now, anything from that point that comes out as novel is novel.
But I mean, will it carry on forever? Effectively? Yeah. Okay.
And new things coming on. If your CBD, you do something slightly different to your product, you will have to justify it and show it.
Right. Okay.
But let me clarify your previous question where you're saying that, there are different products on the market. I assume you meant the full spectrum CBD, broad spectrum CBD, narrow spectrum CBD, and the isolate. And that's really a very important question, because depending on which extract is going into your finished product, again, it's your responsibility to tie down the safety with respect to your input raw material. Whether you can be smart enough to do the risk assessment, if the CBD isolate been safety assessed, and you can tie down with the toxicologist the risk assessment of that. And it's really, as a finished product supplier, you need to do the whole vetting of your supply chain.
Yeah.
Right from T0, from the raw material to the finished product.
Yeah.
So you are the one who need to justify, risk assess, to show that it's safe for consumers.
Yeah. So, I mean, this is going to affect a lot of small businesses, isn't it?
Well, the businesses are on there to make money. Yeah. And if they want to make money, they need to take care of consumers. They need to ensure that product is safe for consumers.
And taking the novel foods argument out of it, a lot of this data food manufacturers should have to put a product on the shelf. So we're not asking them to generate really anything new beyond the raw material providers generating safety data.
Yeah. No, I think that's really very, very valuable point, because we kind of mentioned it. This is nothing that other people selling products, foodstuffs, have to go through.
Yeah.
Everyone has to do this because it's ultimately ensuring the safety for consumers. Cool. Okay, great. Well, thank you guys. Loads and loads of stuff to talk about there. And this will undoubtedly kind of develop through, the next 6 months or a bit before the end of the grace period. So I'm sure I'll have the pleasure of having you back on at some point again.
Thank you.
Thank you, Anish.
Cheers.